Chapter 17, Nutrition During the Growing Years, Screencast 4. Now, the focus of this screencast will be the introduction of solid foods into the diet of babies. Nutrient reserves become depleted, and human milk can no longer meet all nutrient needs as babies continue to grow. Iron-fortified cereal can meet nutrient needs of infants from the age of 6 to 12 months. By starting to add in varieties of food after 6 months, children become more willing to try foods and get a more nutritious diet. Most babies are ready for solid food at 6 months. Foods can be based on some of the following criteria. Nutritional need: baby has doubled birth weight and weighs more than 13 pounds. Physiological capabilities: kidneys and intestinal tract should be more mature. Physical ability: can now control head movements and sit alone with support. Extrusion reflex weakens and can make a chewing motion. Breastfeeding could be exclusive for the first year. Bottle feeding: use appropriate bottle feeding practices. Avoid bottle propping. Feed only breast milk or formula in bottles unless otherwise directed by physician. Food introduction: introduce solid foods around 6 months of age. Expose the baby to a wide variety of healthy foods and also offer a variety of textures. The American Academy of Pediatrics has issued the following guidelines. So we're introducing a few things here. So healthy snacking: after 9 months, offer 2 to 3 healthy and nutritious snacks per day. Maintain fruit and vegetables intake after finger foods are introduced. Foster self-feeding: encourage babies to use spoons and fingers to feed themselves. Encourage babies to drink from a cup starting at 6 months of age. Parents need to recognize hunger and satiety cues. Healthy drinks: babies should drink breast milk or formula for the first year of their life. Try to avoid introducing juice until child is a toddler. If juice is introduced, wait until 6 to 9 months and limit the consumption to 4 to 6 ounces. Avoid the introduction of sugar-sweetened beverages. Now, between 6 and 12 months, human milk or formula intake gradually decreases while solid food increases. At 1 year of age, calories should be divided between milk or formula and solid food. Food should be added with one ingredient. Wait several days before adding another, making it easier to identify food allergies or food sensitivities. Common foods that may cause allergic reactions are egg whites, chocolate, nuts, and cow's milk. The sequence is designed to respond to physical maturation and nutrient needs. Iron and vitamin C will be the first nutrients needed. Iron-fortified rice cereal introduced first, followed by fruits that have been pureed along with vegetables. Protein-rich foods are introduced at about 6 to 8 months. These could be pureed meat, fish, chicken, beans, egg yolk, tofu. It is best to avoid egg whites and cow's milk. When cow's milk is introduced, whole milk is used until 2 years, reduced fat after the age of 2. Lumpy or chopped foods can actually be introduced when teeth start to appear. Here is a sample daily menu for a 1-year-old child. I'm not going to go through this. This is something you can kind of take a look at on your own. But if we look at the overall nutritional analysis, this menu has 1,100 calories. 40% of the calories are coming from carbohydrates, 19% of the calories from protein, and 41% of the calories are coming from fat. Now, weaning from the breast or bottle. Drinking from a cup will help the weaning process. Infants should be weaned from bottle by 18 months to prevent overconsumption of beverages, childhood dental caries. Do not put infants to bed or prop up a bottle when child is in infancy, as this increases the likelihood of dental caries and or ear infections. Self-feeding generally starts in late infancy and continues to develop until the preschool years. Now we're going to see a requirement of coordination, and this can only develop if the infant and baby is allowed to practice and experiment, so patience is required. Now, here's an estimated timetable of self-feeding. By the age of 1, they should be able to drink from a cup without help. By the age of 2, can lift, tilt, and lower a cup and use the spoon. By age 3 or 4, use a fork. By age 4 or 5, use a knife to cut soft foods. Now, the next couple of slides are focusing on some clinical perspectives and potential nutrition-related problems of infancy. Colic. This is going to be a sharp abdominal pain. Infants will cry for 3 or more hours and do not respond to typical remedies. This starts at 2 to 6 weeks and lasts for about 3 months. They may have flatulence, clench their fists, hold their body straight, drop legs, and want to be held. The cause of colic is unknown. Gastroesophageal reflux. This develops before 2 to 3 months and generally resolved by 12 months. Lower esophageal sphincter does not completely close. Milk allergy. Proteins in cow's milk may cause allergic reactions. Switch to a soy-based formula if an allergy is suspected. Most milk allergies actually resolve by the age of 3. Ear infections. Bottles filled with liquids can pool in the tubes leading into ears, can promote bacterial growth leading to ear infection. Dental caries, so cavities form when bacteria in the mouth metabolizes sugars and starch, and this forms acids that actually erode tooth enamel. Early childhood caries are the result of sleeping with a bottle in the mouth. Diarrhea. This is of concern because it can cause dehydration. Symptoms of dehydration include dry mouth or tongue, few or no tears when crying, no wet diapers for 3 or more hours. The baby expresses irritability and listlessness. Cheeks and eyes appear to be sunken. Dehydration can be prevented by giving fluids with electrolyte replacements.